Hi everyone, Dr. Bissell here again for our weekly update on the COVID-19 pandemic situation in the New River Health District. Today's Friday, November 6th. Though pandemics are global, they are experienced locally and each community's experience is different. That's why learning about your local region is critical. Right now, the disease is on the rise all over the world, and Southwest Virginia is no exception. In the New River Valley, our cases peaked in early September. Overall, our cases are down, but we've hit a plateau in new cases rather than seeing continued decline. And who gets the disease is changing. Most of our cases in the New River Valley had been college students who shared COVID in their own social groups, but they didn't share it in the general community. You can see that in this graph, where the teal is predominantly the college population. If you look at the last few weeks, however, you'll see that the red, which is our population over 25, is becoming a larger proportion of new cases. Our investigations are showing these cases not to be crossover from our students, but instead to be coming from travel, carpooling, small gatherings of friends and families, and gatherings moving indoors as the weather gets colder. We have to remember to practice good public health safety precautions at home, at work, and at play. We all have to do our part to slow the spread. We have 12 outbreaks in the New River Health District. 4 in long-term care facilities, 4 in other congregate settings, 2 in higher education, 1 in childcare, and 1 in a school. Jaws High School has moved to all virtual learning until November 16th due to an outbreak among staff, and we're working with them on measures to contain, mitigate, and prevent future occurrences. We can slow this community spread by a few basic steps: wearing masks, watching our distance, and washing our hands. This is critical right now because our community spread has the potential to become more dangerous than the large spikes from our students earlier this fall. Our general community, unlike our student population, is a mix of generations and contains or interacts with more vulnerable people. It's our role in public health to protect those vulnerable populations. It's also critical because we want to fight isolation and protect our mental health. We want to protect our children's education, and we want to protect our workplaces. We continue to see evidence that wearing face coverings works. It stops the contagious person from spreading the virus, and it protects the person wearing the mask. Wearing a mask may well keep you and your family out of the hospital. Do this to protect yourselves and to protect our valuable healthcare resources. We've also learned that we do not have to lock ourselves in our homes to control this disease, but we do have to work within our risk levels, limit the size of our groups, and meet in well-ventilated spaces. Outside is best. If we are high risk or interact with high risk individuals, we need to choose lower risk behaviors. While we fight COVID, we're also fighting the dangers of isolation, which include physical and mental health risks. Because of this, I'd like to talk about Thanksgiving. This year, Thanksgiving requires a different kind of planning. Although many families are choosing not to travel or gather, other people in our region will be traveling. Some families must balance the dangers of isolation of the vulnerable with the risks of the pandemic. In the New River Valley, our college students and their families need to prepare for the students returning home for nearly 2 months. We ask that every household that will be traveling or accepting travelers be careful for at least the 2 weeks before. This means that next week at the latest, these households should be engaging in the strictest possible behaviors, even quarantining. Then, the travelers should plan their travel carefully with food and comfort breaks. If high-risk individuals are involved, the newly mixed households may want to wear masks indoors and connect with each other in well-ventilated areas, such as outdoors. We need to focus less on the meal because that's when our masks come off. Spreading it out if indoors, or dining outside if the weather will permit. Many people are asking about getting tested. Anyone who wants a test can get one. But please remember, a test is one point in time. You can test negative today, but if you were at a risky gathering in the past week, you might be positive tomorrow. The safest course is still behavioral control. I'd like to close with an additional appeal to everybody to please take care of your mental well-being. We are seeing growing signs of stress in our region, and our added social and political issues. This is a time to grant each other more grace. The Virginia Department of Behavioral Health and Developmental Services has instituted a Virginia Copes Warm Line to support those struggling with trauma, grief, or distress caused by COVID-19. That number is 877-349-6428. If you or somebody you know is struggling with a mental health emergency, please call New River Valley Community Services at 540-961-8400 any day, anytime. As always, please remember, wear a mask, watch your distance, and wash your hands. And please stay home if you are sick or have had close contact with a known COVID case. Together we can get through this. Thank you.